So we're this is about how to learn while caring within healthcare settings. It's a bit of a tricky one sometimes with this. I'll just tell you briefly who we are. So I'm the director of the Dementia Service Information Development Centre. We're based in St James's Hospital in Dublin, in Ireland. We've been around now for a little over 25 years. We're state funded, and we're here to promote, I suppose, best practice in all aspects of dementia care. So it's fairly niche, but it's a growing area of interest. And we're basically here to try and improve people's understanding and awareness of dementia. There's a lot of kind of misconceptions and misunderstandings around dementia out there, and certainly, surprisingly, it's still amongst healthcare professionals who are a major audience. Though we do also do public speaking and present our work to the local communities as well. So we're even though we're based in Dublin, we are a national organisation, and we work right across Ireland. What we find is the big challenge, and certainly the landscape has changed quite significantly since COVID, is really how to get staff to training sessions. In the past, all of our training would have been done face to face. That's traditionally that's how it would have been done, and then we started branching out into kind of more the e-learning, I suppose, as it came along. And we were, I suppose, developing larger kind of, anything from half hour to kind of 2 hour e-learning training sessions run on kind of traditional platforms. But since COVID, things have changed quite dramatically. And we found it harder and harder to get people, get staff released to attend what would have been, I suppose, traditionally kind of a half hour or full day training sessions. And though even we still do that, we're still on the road quite a lot, and around public-private nursing homes and hospital settings and councils and all sorts, doing face-to-face sessions. But we are finding it increasingly difficult trying well, not us, but the people we're delivering training to are finding it more and more difficult to get their staff released. Partly that's down to staff shortages. What we do find though is that there's even when there is less staff there, they're having to do work harder, work cleverer, but they traditionally are time poor because they're they're either public facing or patient facing in relation to their work settings. So the other difficulty they have is certainly on ward-based training, they have a huge amount of difficulty getting access to computers. Mainly because when you do face hands-on work with patients and people generally, you don't have time to be tapping into computers, and so we needed to find some kind of way around that, some kind of solution to that particular problem. So we looked closely at a number of different areas and different technologies that might help with this. And then we came across 7 taps, and we pretty much fell in love with it from the start, really. It looked fantastic. It was very slick, but it was also gave us an opportunity to take our learning in a completely different direction. We were able to look at very tight topics. Rather than kind of a wide-ranging, rambling kind of talks, we would do stuff that's very, very focused, very targeted, as I said. It forced us as educators to take complex content and really break that down to its constituent parts. And I'll show you a good example of that in a minute or two. It also gives us the opportunity to integrate all of the different kind of learning methodology that the educators as educators that we use, to try and keep people engaged and activated. So the fact that 7 taps gives an opportunity to use things like to gamify some of the knowledge learning, to use flashcards, video, AI has already been mentioned, infographics, stuff like that gives a chance to keep people, keep their attention, keep them engaged in what we're delivering to them. And the other thing was that even though a lot of the staff wouldn't have access to computers, they would always have their mobile phones in their pockets. Now, that again also causes problems, because when certainly with ward-based staff, managers aren't happy seeing ward-based staff tapping around on their mobile phones in the workplace. But for certain circumstances, and certainly in relation to education sessions, they were happy for them to use them. So we got a bit of a pass on that one. So these are some of the examples that we did. These QR codes are all live if you want to have a go at any of them. And they're just slightly different examples. The meal times, so the first one on the left there, improving the mealtime experience for people with dementia, that was the very first 7 Taps program that we put together. And that was put together primarily as a bit of a test, to be honest. We've been working with the nutritionists within the hospital for on and off for a while, and they produced this really nice. I suppose it was an extended booklet, if you like, on nutrition and the importance of nutrition for people with dementia. Because it may surprise you, even within healthcare settings, that people with dementia can often be found to be malnourished and underhydrated primarily because they often aren't prompting people to asking them for food or for drink or whatever. So and sometimes they forget to eat or to drink, and without people prompting them to do that, then they become dehydrated or malnourished. So this was partly in response to that, and partly just to highlight the importance of good nutrition for people generally. This was it was quite a long piece that the nutritionists had put together, and we talked about doing something to simplify that. And at that time, we'd just come across 7 Taps, and we brought it to them and said, would you like to try something like this, and as a bit of a demonstration? And they jumped at the chance after seeing it in operation. And we pulled this together, and it's still going. People are still accessing it, and I think just the other day I had one of the nurse management teams come to me and start asking if they could use it in a wider nutritional pathway for the hospital. So that was reassuring. So that was very much an education piece. The middle one, Lost and Found, that was a group of it was an occupational therapist who was working in one of the other clinics, who was working quite heavily with people, caregivers and supporters of people with who are living with dementia. And there's a whole raft of areas of stress that carers and supporters of people with dementia experience, and misplacing items is one of those. It causes huge amount of stress on that cohort. And so I very quickly pulled together this a way of perhaps suggesting different strategies and workarounds for managing the misplacing of items and trying to minimize that problem. So that's a slightly different approach to education, to a completely different cohort. It wasn't aimed at healthcare professionals, very much aimed at the general public. The activity corner one, this is more about the hospital provided these activity trolleys to try and keep people with dementia engaged, through what can often be quite boring times on ward within the hospital. So they put all these trolleys together, but the trolleys just sat there because staff weren't quite sure what they were there for, or what they were supposed to do with them. So we put together this kind of this quick guide as to how the staff might utilise those. So that was quite interesting. This one here, the person-centred care module. This one was kind of brought about because it's been something I've been wanting to work on for a long time. For those of you not in the person-centred not in the kind of healthcare world. Person-centred care, the phrase person-centred care has been around for a long time. I hesitate to think how long now, probably about 30 odd years, but it's repeated endlessly in healthcare settings. And my feeling is that it's because it's used so kind of loosely and flippantly these days. It's possibly come to the point where it, as a phrase, it's almost become meaningless. It's just three words that people trot out without understanding what's actually behind that. And it is a relatively complex concept. I haven't got the time to go into it here in detail for you today, and I'm not going to try. But what we did is I asked one of my team to take. We have a library here. We're very lucky we've got our own library, and I asked them to go away and I said, pull everything you can together about person-centred care, and I want you to take, and that runs. There's people write books on person-centred care. I said I want that stripped right back to its absolute basics, and we'll see if we can get a micro-learning piece out of it. It's almost like a challenge, if you like. So what we ended up with is 3 8-minute modules. And we broke down the whole concept of person-centred care to 3 things, which is responding to distress, respecting the person, and making a connection. And just as I mentioned earlier, we introduced quizzes, MCQs, and things like that, AI, to help consolidate learning and keep people engaged and understanding. What we found, though, is this thing's become very, very popular, and certainly very popular amongst the management outside of our own little kind of care of the older person or the dementia world, which is a significant part of the hospital. But there's obviously there's the whole rest of the hospital as well, and it's a fully acute hospital. So, but it's developed and it's picking up traction elsewhere in the hospital as well, which is great. But this one, we're very pleased with this one. And again, QR code's live. You can have a look at that. I will say that my last bullet point there is probably not quite true at this point, because we just sent away our web designers to go away and have a look at. We just asked them to rearrange the setup of our Moodle, so it's not quite available on the website yet, but it will be very, very shortly. So I was hoping when I wrote this that it would actually be ready, but unfortunately not. So we've had a lot of management support in relation to this. We have a Quality and Safety Improvement Directorate, which is a very powerful department within the hospital who've jumped on this. Really love the person-centred care model. Love this kind of micro-learning approach to things, and they've allowed us to dedicate their latest newsletter to this topic. They have several hospital notice boards, large hospital notice boards situated in various strategic points around campus, and these involve a very large poster and then 2 kind of A4 size pieces, and they've dedicated the whole these notice boards over to this to drive this person-centred care module around staff, so which we're delighted with. We've been asked to present it at various committees. We've got full support of the Director of Nursing within the hospital, and we are the largest hospital in Dublin, in Ireland, sorry. We've got about 5,000 staff here, and all the Assistant Directors of Nursing as well. We've had access to all the clinical director and management teams, and not just this course, but the nutrition course, as I said as well, it's going to be made available on the hospital's own learning development platform, which everybody has full access to. So we're very, very pleased with that. And in fact, the management teams are starting to take a huge interest in this whole process, the whole idea of concepts around microlearning as well. So I think the trailblazers within the hospital, which we're pleased to say. Last couple of slides now. This one, you'll see the relevance to Barbie in a second. If any of you have ever been to academic conferences, and specifically academic healthcare conferences, you'll have come across the academic poster sections. these can be tough going. These can be very tough going. They can be tough going both as an attendee at a hospital, going around and trying to read these things, because traditionally they're information heavy. As you can see, this is just a mock-up of one. So there's usually loads and loads of information crammed on them. There's graphs and complicated looking pictures and just way too much information. If you're presenting a poster at these kind of events, and these tend to be big conferences, big health conferences, you often find that you've stood there by your poster while people with glazed expressions, kind of walk by in group after group after group, and they don't stop and they don't talk to you, they don't engage with you, because it tends to be so niche. So I thought we were presenting a poster at Alzheimer's Disease International, which is probably the biggest global gathering of dementia specialists in the world, and it was in London a couple of years ago, and we were presenting a poster there, and I thought I cannot stand in front of a poster and present, and just have this experience again, because it's soul destroying. So what we decided to do Operation Barbie, and we thought let's really subvert the academic poster. And so these things, when you present these posters, they come in A0 size, so they're big, and so we came up with this concept, and we decided, because in 23 Barbie was massive in cinemas and in popular culture generally, we jumped on that bandwagon wholeheartedly and unashamedly, and we whacked up this poster in the exhibition hall in London, and we got huge attention, and we had groups of people coming up, taking a photo with it, and scanning the QR codes, engaging with me. We gave them these little kind of, if they didn't have the time to actually run through the program there and then, we gave them these little credit card sized calling cards, if you like. You can see the little image of that on the left. So Barbie with a case goes to takeaway. And just it was fantastic. And we whereas you might get 4 or 5 people at a conference coming to talk to you about your particular poster, your topic, we got we got something like 150 hits on the day, and then it grew and grew over the next few days with people accessing it there further down the line. So we were thrilled with it. So that was a bit of a laugh, and it was a bit of fun for us, as well as getting a serious message across, because the topic was about how to improve how we communicate diagnoses of dementia to people. I just found it, if any of you guys out there are one of these kind of fact checkers, and you're going to pull me up for saying that Barbie's 83 years old, and well, that's not quite true. Well, we were a wee bit flexible with that. If you do want to check, Barbie was invented and first produced in 1959, which would have made it around about 63, 64. But in actual fact, Barbie was based on a woman called Barbara, who was 19 years old at the time. So we took that 64, stuck 19 on it, and got 83. So there you go. So that's me finished. So thank you very much. I will stop sharing.
Awesome, Matthew. Well, can we get a round of emojis for that? I got to say the fact check on the Barbie, that was awesome. I love how you used your creative math. And honestly, a really, really creative, I love when people do that outside the box attention grabbing stuff. That's like, hey, we're just trying to make this practical and fun. So thank you so much for sharing your experience and just the great ways that you've used microlearning in this, Matthew. It's been awesome.